Good afternoon, everyone, and welcome to the AFib Quality Exchange Call. My name is Michelle, and I'll be your moderator for today. Feel free to ask questions throughout the presentation by typing them into the Q&A box on the right-hand side, or coming off mute by dialing *6. If you would like to zoom into any part of the slide, use the magnifying glass shown on the left-hand side. The slides and a link to the recording will be provided within 1 week. I will now turn the presentation over to Deb Motes, our Senior Director of Quality. Deb, the floor is yours.
Thank you, Michelle. Can everybody hear me?
Yes.
Okay. All right, so welcome to the first quarter 2019 AFib Exchange, Quality Exchange. We have been doing this now for a little over a year, maybe closer to 2 years. And actually, we do this for you so that hopefully we can give you some good information, as well as for you all to be able to connect with one another and work on quality improvement. So if you have questions, comments, please *6 and unmute and ask the questions at any time, or you could just type them in the question and answer box, and Michelle will tell me about it. So think about what you want to learn or discuss today, because these calls are actually to facilitate an exchange. So starting with my agenda, we'll start with the welcome, which I just did. I'll talk about who I can contact, and prior to that, I'm just going to kind of give an overview of a few things. We'll talk about day-to-days. We'll talk about some important dates that will be coming, what's new on the horizon, and then some educational opportunities. So why get with the guidelines AFib? Why would anybody want to use this? Well, first of all, when the heart rhythm gets out of control, healthcare costs do as well. Patients with AFib are twice as likely as non-AFib patients, or hospitalized. They're hospitalized twice as often as non-AFib, with 3 times the rate of multiple hospitalizations. And, we oftentimes will get penalties for those readmissions within 30 days, no matter what the cause is. So that's pretty important, because I don't think, I'm not sure if it's still that way, but I don't think if there's a readmission within 30 days that the hospital gets paid anything. So it's important for us to try to keep these AFib patients out of the hospital. And then with the prevalence of AFib on the rise, Get With the Guidelines AFib can help you meet that challenge. So what it is a quality improvement program. It's designed to help hospitals with the latest evidence-based treatment guidelines. And the goal is quality AFib care and prevention of related conditions such as stroke and heart failure. So AFib and the implications for stroke. AFib causes 15% of the 700,000 strokes per year in the U.S., and that's a pretty good chunk of strokes, especially if patients are not on the correct medications as far as blood thinners or whatever they may need to prevent those clots from forming. The risk of stroke, if untreated, is 3 to 12% per year. I don't want to be in that 3 to 12% for sure. The annual cost of stroke is $57.9 billion, and stroke from AFib has a higher severity, disability, and mortality. And as we know, a lot of those strokes can be large vessel occlusions, which contributes to that high severity and disability. But there are therapies that can prevent stroke in AFib. So, it's important. That's another reason why it's really important that if you're using the Get With the Guidelines, that you're using it to your full ability and making sure that you're able to mine the data a little bit and see what kind of improvements you may need to make, or, anything like that. So optimal treatment of AFib reduces the risk of hospitalization, which is exactly what we want to do. And AFib is common in heart failure, MI, pneumonia, CABG patients, and PCI. AFib independently increases the risk of hospital of these conditions. And then optimal management of AFib will increase readmissions and penalties from CMS, and those are things that we really, really want to avoid. So what do you get with the guidelines AFib? Well, first of all, it helps save lives. It really does, and it saves costs and lives by holding the hospitals to the latest scientific and changing the landscape in 5 ways. First of all, you have a very powerful patient management tool. There's not quite as many patients in here as there is like in the stroke modules and some of the other modules, but there still are over 50,000 patients that you can benchmark against. It's real-time data collection to show how your hospital is adhering to the guideline measures. There's point-of-care education materials that are available. If you go to the AFib website, just type in Get With the Guidelines AFib, and there's a lot of point-of-care material, as well as there's educational materials within the module itself that you can download and print and hand out or do whatever you'd like with it. There's integrated decision support, and then arrival, discharge, and follow-up care forms are available. Another really important thing to know, if you don't already, is that all of our directors in our Southwest affiliate, are available for one-on-one consultation at any time with you. So if you need PMT support, if you want to look at ways that you can improve processes, we can definitely help walk through some of those ideas and thoughts, and just help you in whatever your needs may be. We are available, like I said, all of us, especially the directors in your area, for one-on-one help. The other number 3 is you get recognized. So if you're able to maintain that 85% or higher compliance, then you can be recognized at the bronze level, which is 90 days. There's a silver level, which is 12 consecutive months at 85% or higher of the performance achievement measures. And then there's the gold, which is 24 consecutive months of compliance at 85% or higher. It's cost effective. It's not that expensive for the enrollment fee. And probably the highest expense for you all is, I'm sure, your abstraction cost, because that does take a while and it takes a bit of time to abstract some of these costs. But if we're able to use that data and that information in a way that helps process improvements, then it's well worth the cost. And it will help to reduce your readmissions and your morbidities if you're able to follow those clinical practice guidelines. And the 5th thing is there's webinar access, such as this one that we're having right now, and we've had a couple others. Sometimes we do local workshops if there's several hospitals that need assistance or want information. We're happy to come in and do some kind of a workshop for you or educational event. And then there's also the patient education resources. So it's a great tool to use in providing care, evidence-based care to our AFib population. So in case you don't know, we recently hired 4 new directors, so all of our positions now are full. So just to kind of give you an idea on who you contact, depending on where you live. So Allison Capetillo is in the Houston area. She covers all of Houston and that surrounding area. Larissa DeLuna, she covers the Bryant counties and then Corpus Christi. So the Austin area all around there, and then Corpus Christi areas, Victoria and down into the valley. Then we have, Corpus. Then we have Sarah Dazinski. Sarah actually covers the valley. I apologize on that. And she also covers Austin and San Antonio. So she's got a pretty large area to cover. Christy Esposito is one of our new directors, and she is in the Dallas-Fort Worth area and is available to help you to answer any of your questions. Flannery O'Neill is actually, she was recently hired as well, and she covers Southern California and New Mexico. And we divided Colorado up because, it's just such a long ways away. So we're able to better cover all of the Colorado needs. So Flannery is, like I said, Southern California and New Mexico, and she also is our director expert for for the AFib module. So she is able to help us a lot. She attends a lot of committee meetings that are happen within our own with our own entity. We have an AFib committee that meets and talks about new things on the horizon, things that need to be addressed, and just overall process improvement. Then we have Kristen Weller, and she is in Arkansas. She covers all of Arkansas. And then we have Alicia Webster, and Alicia covers Amarillo, Lubbock, Midland, Odessa, and Tyler areas. So there's coverage now for everybody. If you have issues, if you have questions, if you have concerns, please reach out to your director. Also available, we have Lonnie Vent, who is one of the senior directors, and she covers all 6 states, coronary artery disease and Mission Lifeline. And then we have Cherie Boxberger. She also covers all states and she's a vice president. Actually, Lonnie and her are both vice presidents. And Cherie covers heart failure and resuscitation. And then I cover stroke and AFib in the 6-state area. So any questions, concerns, information you have specific to a module or whatever, please feel free to reach out to us because we are here to help you. So next I'm going to talk a little bit about day-to-day email and measures. And why do we do this? Well, the main reason we do it is to help you all to know where you are each quarter, to identify any process improvements, issues early, if there are any, that can be addressed so that you are able to reach that award level. So you get a detailed email with each measure highlighted in red or green to indicate whether it is failing or passing status. And we do this quarterly. We also send you the list of patient fallouts as indicated. And this report is actually a static report. I know a lot of times people will go in and will fix things or, find other documentation that they're able and then ask us to rerun it. Well, the really pretty report that I'm going to show you next on the next slide is a static report. So it's only run based on January 1st, whatever information is entered into the PMT by January 1. And now we know that quarter 4 information is not going to be available completely, but that we are here to help and to let you know at least where you're at and see what we can do to help, again, reach that level, award level. So it also will give you the most recently entered chart that you have as of the discharge date, and then considering for the 2018 awards, all extraction must be completed by February 28th, and I'll talk about that a little bit more. So when you receive this email, you notice that there's the red and the green. So you can easily, the email is meant for you to be able to take a quick look and see where you might be having issues with the red as far as not making your 85% compliant would be red. And if you have green, then that means that you are meeting that 85% or higher compliance in the measure. Now, along with that, when you see that red, we also attach to the email a copy of, not only a copy of this next slide that I'm going to show you, but also a copy of of any of your fallouts, so you can easily go back and look at them and see if there's any documentation missed or any opportunities. So this is a beautiful report that we get, and Michelle, our moderator, is the one who put this together, and she does a tremendous job. We look at this, like I said, she gets the reports quarterly. She puts them in these nice graphs, and then we are able to send them out to you along with the email. So what this actually shows you, this is the quarter 4, but you'll get one each quarter. So the first quarter, all you would actually see would be like the 80% and then the aggregate, which would be 80% the first quarter. As we go through, so the first quarter is green, second quarter is orange, third quarter is gray, fourth quarter is yellow, and then we have the blue, which is the aggregate. Now, the reason that we do that is because even though we look at the quarterly report, all of the awards are based on the aggregate at the end of the year. So you know where you are, but at least it will show you month or quarter to quarter how you're doing and if you're improving. Now, in this particular report, it was run a couple weeks ago, so, January 1st, I'm sorry. So we know that, like I said, those quarter four, this yellow, as well as the aggregate here, is not going to be complete. So those numbers, you can expect to see those numbers go up a little bit if you are able to be compliant with the measures. So the first measure we have is the ACE Arbor Arnie that's prescribed at discharge. So looking across, you can see we started at 80%, and this happens to be our the Southwest affiliate. This is an aggregate number of all of our hospitals that are participating in the AFib module for our Southwest affiliate aggregated. So overall, for the ACE ARB or ARNI, we're about 87%, which is over the 85% requirement for compliance. So that's really good. And then the other thing with this report is if there are fallout, you'll see the red X at the bottom. Again, you can easily identify what's falling out as far as what measure, and then you can go in and look at your actual fallout measure that's attached to the email to find out exactly which patients are not meeting the measure. The next measure is the beta blocker at discharge. We're at 100%. That is amazing. Congratulations. There's a lot of work that goes into all of this, and I'm sure that you all are working with your teams to help to improve these things. The third measure is the CHAD-2 VASC risk score that's documented prior to discharge. That one seems to be across the board a little bit harder to reach, although look at quarter four. Quarter four is not done, and we're at 86%. So that really shows that you guys are working hard to improve that measure. And in the end, it's going to help your patients and hopefully help prevent stroke from happening. The next measure is the FDA-approved anticoagulation that's prescribed prior to discharge. Again, 100%. Nice work. That is awesome. The next measure, PT-INR plan follow-up, documented prior to discharge for warfarin treatment. So we want to make sure that we have a follow-up appointment with a physician who will be monitoring their INR and those kind of things, especially with patients that are on Coumadin, so that we can make sure that they're at a therapeutic dose so that they do not, so we can decrease the risk of them having a stroke. And then the statin at discharge, actually that seems to be another one that seems to be a little bit harder, and those the statin is for AFib patients with coronary artery disease, CDA, TIA, peripheral vascular disease, or diabetes. So if any of those are in the history, then the expectation or the compliance measure is that those patients are discharged on a statin. So started at 86%, it dropped a little bit to 81, dropped a little more to 73, and then back up to 78. So overall at 80%. So again, these are not final measures, but kind of give you an idea. So just for the heck of it, I threw out this slide from the last time that we talked, and there were 7 of 8 hospitals included in this. And, wait a minute. I think, actually, hold on. Let me go back one. I might be confused. Oh, no. That was just showing you the example. I am so sorry. So this actually is our aggregate information. So this is what we're looking at. The ACE ARB, the overall achievement for the ACE Arbor Arnie is at 80% for our Southwest affiliate. Again, pretty close to that last report that we saw. Beta blockers, 96%. That's awesome. CHAD VASC score, like I said, has been a little bit of an issue, but seems to be getting much better. It's up to 90% now. And I don't know if you all have seen that, but there was a webinar that was excellent that was recently provided. And I will give you some more information on that as well as a link to it, so that if you were not able to watch that webinar, then you might want to go in and take a look at it. FDA-approved anticoagulation prescribed prior to discharge, overall at 99%. That's excellent. PT-INR plan follow-up at 82%. That's a little bit down, but look at quarter four. Quarter four was 100%. So, we may be a bit higher than that once all of the data has been abstracted into the PMT. And then the statin at discharge, again, seems to be a bit of an issue, and that is at 79% for our aggregate Southwest affiliate right now. So, when we look at it, if there's certain things that you guys are doing that are on the phone that are related to any of these measures that are below 85, whether it be the ACE-ARB, whether it be the CHAD-FAST score, or whether it be the statin at discharge. If there's certain things that you have done for process improvement, then please share those with your colleagues because it's really helpful. I think we're here to support one another. AHA is here to support you, and hopefully you are here to support one another across the country who working on this, working on the best practices for AFib. So at this point, are there any questions or comments? Let's just stop for a minute. Please *6 if you have a question, or you may certainly type it into the question and answer box, and Michelle will let me know. So I'm going to give you just a minute to do that. So please, don't be shy. No question is a bad question. Okay, you're going to be shy. Okay, so the next one is, this is where I thought I was the last time, where I was a little bit confused. But during our last quarterly report, we did a trend just to see how things have gone on as far as meeting the measures from 2013 through 2017. So when we're looking at it, it looks like we started in 2013 at 90%, and this is the whole nation. Anybody who is entering information, this is not just the Southwest affiliate, it's everybody that's participating in this PMT. So at this point, nationally, the ACE-ARB is at 87%, and 2018, like I said, we are at 80% for fourth quarter. So, and that number is not complete. The beta blocker prescribed at discharge, 96% here. It's also 96% for our Southwest affiliate for 2018. For 2017, the CHAD-FAST was at 72%, and y'all have made some progress on that. We're at 82% and climbing. And then we have the FDA-approved anticoagulation prior to discharge at 98% in 2017, and it is 99% for 2018 to date. So great work. PT and INR had risen to 89% for, well, actually it went up to 91% for 2016. 2017 it dropped a little bit to 89%, but still within the compliance measure. And in our Southwest affiliate, we are currently at 82% for the aggregate for 2018. And then the statin at discharge for AFib, 80% was the 2017 result, and we are at 79%. So we are right there. So it's showing that you guys are all working on this, and it shows, because I think anytime you pay attention to a measure or do education, then those measures do improve. So it's important to keep track of them, share them with your staff, let them know what's going on so that they can buy into the program, that you are making progress and you are doing well. So question, are you tracking these measures that could improve atrial fib treatment and lower stroke risk? There's 3 performance measures specifically that's backed by science that's used to develop the AFib guidelines and are appropriate for public reporting or pay for performance. So some people do public reporting. If you want to post your results on your hospital website, that's great. The 3 measures that I'm referring to, or they are referring to, is the CHAD-2 FAST score. That's documented prior to discharge. The anticoagulation prescribed prior to discharge, which looks like we were doing very well with that one. And then the PT-INR plan follow-up prior to discharge. So those are all measures that you may want to just share with the public. Let them know that, how you're doing and that the improvements that you've made over time. So some important dates to remember. First of all, January 14th, the week of January 14th was when we did the year-end snapshots of Get With the Guidelines, and that is when Michelle was able to put all of those wonderful reports together, and we sent them out to you. Then a couple weeks after that, we scheduled the AFib Quality Exchange Call, which is happening today, and reason being because the information is forefront in your mind because you just received your report not too long. And so if there's questions or if you want to share best practices or anything like that, then that is available for you. February 28th is the last date for the quarter four. Well, the quarter four data is due. It's not really the last date overall, but to be abstracted into Get With the Guidelines. That allows your director the whole month of March to be able to look over the report, talk with you. If there's anything that can be resolved, then, you know, we can fix those, or you can fix those things in your PMT. And we just try to work with you. We really want to help people to get to a ward level so that you have that information and you can let the public know, let everybody know. March 29th is actually the final day to change any 2018 data. So between in March, anytime in March, if you have talked with your directors and it looks like everything is confirmed, you're award eligible, then do not go back and change anything in that 2018 data. So not adjust the PMT in any way, because one little adjustment can make a huge difference of whether you're compliant or not. So you are able to change your information anytime up until March 29th of 2019 for the data in 2018. To be able to reach the award level. So, yeah, again, once again, the special note, once your director's confirmed it, do not edit, adjust, or adjust the PMT in any way. We have April 5th and 6th coming up in 2019. It's Q-Core, which is a great quality educational session, kind of like we have the acute ischemic stroke or the International Stroke Conference in annually. This is the one for all of our other modules. So the April 5, 6 educational event is in Ritz-Carlton, Pentagon City in Washington, D.C. And this is going to be the new venue now for recognition events. So if you are at 85% or higher for 2018 and you get the certificate, or you get recognized, this is where that's going to happen. We will be recognizing hospitals during the Q-Core event. So if you're able to attend, it would be great so that you are able to represent your hospital and all the great work you do. All the modules are addressed at this Q-Core except stroke, although there are stroke measures or stroke information often within this particular conference. Okay, and then in May, the recognition awards are approved and distributed. So the whole month of May, then your directors are verifying that all of the measures are made, that you get your recognition, just looking back that everything is approved, everything is double and triple checked. We get information initially from the National Center, who runs all of the reports for recognition. And they send those out to us, to the quality directors in May, so that everything can be looked over and approved and make sure that we're not missing anybody who has reached that level. So just another double, triple check. And then in July, we do the U.S. News and World Report that includes all gold and silver recognized hospitals, is published and distributed. Now, if you are looking for this last year's July U.S. News and World Report, your directors do have hard copies, and just reach out to them, and I'm sure that they would share them with you. And if they don't have any, then I do. So if you need some, then just let us know. We're happy to share them if you want to post them in your departments or whatever you may want to do. So what is on the horizon? Good question. So I don't know if you know this, but just yesterday, the new 2019 focus update for our clinical practice guidelines for patients with atrial fib was released. So just yesterday, you guys are the first to probably know about this. It was the American Heart Association that cites, or this is how you cite the article, actually, if you're going to cite it in a paper. But it focuses on guidelines for the management of the patients with atrial fib, and it's done with cooperation with the American College of Cardiology, the American Heart Association Task Force, and the Rhythm Society. So we all get together, take a look at these. Not we, the scientists do. I'm not the scientist. Scientists do get together and review all of the material and update guidelines as needed. So as I said, the first one was released yesterday, and the link will be in your email so that you can take a look at those updated measures and the publication. Watch your email. We will be scheduling a webinar very soon. It's not scheduled yet, but there will be one scheduled soon to discuss this publication and the information within it. So keep an eye out for that. I think it'll be a really good educational opportunity for you. So other professional education resources. Actually, let me stop there to see if there's any questions, any comments.
There is one question, Deb. It refers more to a heart failure question. I'm curious why the AFib PMT, the specific amount for warfarin, is not required on discharge, but for the heart failure PMT, it is. Often the amount is variable, and we enter other for the amount prescribed.
Oh, you know what? I don't know why that is, but I certainly can send that to our science committee. So Michelle has that question, and what I will do is forward that to the science committee and find out if there's plans to make any changes or anything like that within the PMT to better monitor it. And, you know, there may be changes within the PMT now that these guidelines have been published. There almost definitely will be some. So I'm sorry I can't answer your question straight out, but I will definitely follow up on it. Any other questions or comments? No? Okay, thank you. That's a great question. All right, so AFib Best Practice Series, Raising the Bar for CHADS to VASC Risk Assessment webinar. So this webinar happened on January 16th, so last week. This was, or was it this week? I don't know. I don't even know what day it is. Anyway, it's an excellent, like I said, WebEx. You can go into the flyer if you had it on your calendar and was not able to see it. You can go right into that calendar invite where it says register now. You can click on that, register now, and that recording will be available to you. I also included the link so that if you want to go in there and take a look at or listen to this WebEx, get a copy of the slides, whatever, then you are able to do that. So it was actually two physicians that talked about the CHADS-2 VASC score documentation. And I think one thing, I'm not sure if everybody knows, but nurses are one of the people, when you look at your coding instructions, that can document the CHADS-2 DS2 VASC score. Now, I know that ideally it's going to be the physician, and hopefully it'll be the physician. And actually, they will talk about ways they talked about ways on this WebEx in order to help to get that accomplished with your physicians, and a lot of it is through the medical record, the EHR. But in this particular hospital, they actually send thank you notes to the hospitalist, or to the physician for documenting it. So they take a look at it. They send a reminder. There's little reminders that come up to document this score in the medical record for the physician. And then once it's documented, they have an atrial fib coordinator, and she sends those reports out to the physician. So just something to think about, maybe a way to increase compliance within this measure. Questions or comments on that? Okay. So another important event that's coming up, it was coming up actually for February 27th. Actually, it is our affiliate, Midwest affiliate from the American Stroke Association who's hosting this event. It's free of charge. It's from 11 a.m. to 3 p.m. Eastern Time or 10 a.m. to 2 p.m. Central Standard Time. It's 100% online, and it's worth 3.75 CE. So I put the link to that in there. I have discussed this with our counterparts in the Midwest, and they have agreed to let us offer this as well through them. So if you get an opportunity, then please register for this. It looks like it's going to be really, really, really good. And it will address multidisciplinary approaches to atrial fib, and it's a virtual conference. So get in the rhythm and stay in the rhythm. So I'm really excited to see what's going to be within this WebEx, and hopefully you'll have time to be able to register and watch it. Another recent, actually coming up soon is check change control cholesterol. I just added this because of the new guidelines. The new guidelines have now been released, the 2018 guidelines, and so they will be discussing those guidelines within this particular WebEx. Now, the check change control cholesterol program is typically for the clinics. So if you have an AFib clinic, you may want to send this information on to them so that they can watch that. So share with high and wide, share the link, and we would love to have some of you participating within these WebExes because we're doing them for you all to help with education, and it's a benefit of your Get With the Guidelines participation. I left in here from the last WebEx that we had last quarter. There's some great information at the myafibexperience.org website. There's educational materials for your patients. There's educational materials for you. There's interactive cardiovascular library, so it'll actually show you what atrial fib looks like. If you get an opportunity, then please do take a look at that website and feel free to use anything that you find within there to help to educate your patients and or staff that are working with you. This is another one of the resources just showing you what kind of educational information you may have. So it's written for the patients and with the patients in mind, trying to keep a lot of the technical information from the medical field out of it to make it more easily understandable for your patients. So again, feel free to download these educational sheets and distribute them to your patients. And one other thing, did you know if you guys are participating or your hospital is participating either in the heart failure module or in the stroke module, then you are able to download quite a few data points automatically that will automatically fill in. So when you go into, when you're in the stroke, the heart failure or the stroke PMT, you go down to the bottom where it says, you typically will save it as complete. There's a choice that says save and create a new AFib record for the patient, and that will transfer 120 data elements will auto-populate into your AFib module, which may be a great time savings for you. So just something to think about. The stroke module is the same, except for it doesn't have as many fields that transfer or auto-populate, but within it's the same thing down where you submit your data. Once you finish filling in your PMT record for stroke, then you can hit the save and create a new AFib record for this patient, and it will automatically flow over into your AFib, into your PMT. So just a couple ideas or thoughts if you were not aware of it. It's pretty recent information, so you may or may not have been aware of this. But if not, then get with your stroke or your heart failure counterparts and maybe have them go ahead and download those for you so that you'll have that available. Any questions, comments about that? It's a wonderful service. Anything in the chat box?
Nothing so far.
All right. So another resource, this was a previous AHA event. Again, this was a live webinar that was improving outcomes for patients with AFib. It has been recorded, and if you were not able to watch that, I just wanted to make sure that you were aware of it and that it is available, recorded, and you can go ahead and take a look at that. It is not CME, but it is free, and it's through My AFib Experience, so you can probably go to that website as well and just register and watch it that way. But just so you know that there are resources available for you if you are interested in those. And we're getting close to the end. I just wanted to share with you that we do have a new certification. It's a joint effort with the Joint Commission and the American Heart Association, and it's for Comprehensive Cardiovascular Center certification. So it would include all of your heart patients, whether it's AFib, STEMI, non-STEMI, all of those things. The program, the certification started January 1, so there's like nobody that's been certified yet. So be the first one in your area or in your state even to go through this process and become certified as a cardiovascular center of excellence. That would be so awesome. And so if you're interested, reach out to your director. We have a lot more information we can certainly give you, and you will receive lots of help and assistance from not only your director but also from our national center. So that might be something else you may want to share with your quality directors or your CNOs or anybody who might be interested in that type of certification. Maybe you're working on that as a special process improvement or whatever, but it is there. It is now available, and we are happy to help you if you have any questions or need assistance with that. So that concludes my information that I have. My contact information is here, as well as Flannery. I told you that she is our director in the Colorado area in Colorado and New Mexico, and she will be happy to help you or anybody actually, as well as myself. So are there any questions, comments, concerns? Is this a helpful thing for you? I'd really like to know if you are getting information out of this and if they're helpful. So please *6 to unmute and or type in the chat box. If there's certain things that you would like to know more about, then again, type those in the chat box, send me an email, send Flannery email, anything, and we are happy to cover those during our quarter 2 exchange. So we're going to open up the lines. Any questions? Please feel free right now to either *6, unmute and ask, or type them in the chat box. Anything in the chat box, Michelle?
Not right now.
No? Okay. All right. Well, I hope you enjoyed this, and I hope that you learned something, and check out those new guidelines and the WebExes that are coming up, and I wish you the best in your AFib adventures. So we'll see you next quarter. Thank you. Bye.